Good morning. Welcome to the 31st Annual Southern California Alzheimer's Disease Research Conference. I'm Jim McAleer. I'm the President and CEO of Alzheimer's Orange County. For 31 years, we have partnered with the incomparable UCI Mind, now led by Dr. Joshua Grill, who's become a great partner and friend to Alzheimer's Orange County, and all of the research science and scientists who do such spectacular work there. We are so honored to be a part of this event. And in particular, we thank our staff who have led these efforts and created this magnificent platform of spectacular specialists who will be speaking to you today about technology and dementia. Technology is something we're all having to grapple with today, isn't it? With the advent of COVID and quarantines, most of us are either working remotely or having to struggle with other different types of how technology comes through every part of our lives. Our caregivers are at home more often, with less respite. We have seniors experiencing memory loss who live alone or experiencing severe social isolation. Food insecurity becomes an increasing problem. We need not only technology, but we need research to advance faster and faster for the day where there is no Alzheimer's disease, there is no dementia. So I have a special favor to ask of you today. I know it's going to shock a lot of you, but we are in election season. No, I'm not going to talk about any specific candidate. I'm going to ask you to contact your candidate. Contact their office and tell them that you want them to make Alzheimer's research funding a priority in this next administration. Any office at the federal or state level should be pushing harder and harder to put more dollars in the hands of competent researchers. If you could go a little bit further and ask them to make sure to include our caregivers in their budgeting. Without more federal and state dollars, the ever-growing numbers of people with dementia are not going to have the services, the programs, and the supports they so desperately need. So welcome to the conference. Thank you again to Dr. Grill and our friends at UCI Mind. I hope you enjoy it as much as I know I will.
One team has the passion and talent to defeat Alzheimer's disease. One team is leading the battle to protect our stories and our histories. One team is using tomorrow's technology to help us hold on to our memories of yesterday. One team is performing the cutting-edge science required to combat this global crisis. That team is UCI Mind. UCI Mind is pioneering groundbreaking scientific approaches in drug discovery and clinical research to end Alzheimer's. Join us in the fight to make memories last a lifetime.
Good morning, or depending on where you are, good afternoon or good evening. Welcome to the 31st Annual Southern California Alzheimer's Disease Research Conference hosted by UCI Mind and Alzheimer's Orange County. My name is Joshua Grill. I'm a faculty member at UC Irvine and the director of the Institute for Memory Impairments and Neurological Disorders, or UCI Mind. UCI Mind is home to one of the nation's 32 Alzheimer's disease research centers funded by the National Institute on Aging, one of the National Institutes of Health. Under the leadership of Dr. Carl Kottman, our founding director, we were actually one of the original 6 ADRCs, initially funded in 1984 as a joint center with the University of Southern California. We've now been an independent center for more than 20 years, and we were recently extended in this NIH funding through 2025, something we're extremely proud of. Our collective successes at UCI Mind are a tribute to outstanding scientific leadership over the last 3 decades from Dr. Kottman, Dr. Frank LaFurla, and Dr. Andrea Tenner. But we are also particularly proud of the transdisciplinary and collaborative nature of our organization. UCI Mind is composed of more than 150 faculty and staff. Our faculty are research experts from more than 15 different departments here on campus. What we believe is that Alzheimer's disease and related dementias are transdisciplinary problems that will require transdisciplinary solutions, and that working together, our faculty can answer questions that alone they could not. Alzheimer's disease is a crisis in our nation. Nearly 6 million Americans are living with dementia, and 16 million Americans are financially, physically, and emotionally burdened with providing care to a loved one. We must do more for these families, and our organization is composed of people who have devoted their professional lives to improving quality of life for these families through research to better understand, diagnose, and treat neurodegenerative diseases. Of course, in 2020, we have all known another crisis, the global COVID-19 pandemic caused by the novel coronavirus SARS-CoV-2. Because of COVID-19, we were forced to convert this conference from in-person to virtual. This saddened us because we enjoy meeting with the wonderful community here in Orange County, a community that is highly supportive of the work of UCI Mind and Alzheimer's Orange County. We also enjoy bringing the world's experts here to Southern California, many of whom are our close friends and colleagues. But this novel challenge also brings new opportunities. Annually, this conference reaches more than 400 people. This year, we had more than 1,000 registrations. This includes more than 100 attendees from out of state and a handful from other countries and continents. Believe it or not, we had landed on technology as the theme for this conference before the pandemic, but obviously the topic became all the more prescient when we entered what is now more than 7 months of quarantine. Social distancing and safer at home practices create added challenges for caregivers and families living with dementia. I encourage you to visit the UCI Mind and Alzheimer's Orange County websites to find more resources during COVID-19, as both organizations have put concerted effort to bring information and opportunities to the community during these challenging times. But even before this time, the burden for families was great, and technology holds equally great promise for reducing burden, increasing safety, improving health and quality of life, and of course, accelerating discovery. We'll hear about this promise today. Today, we will hear talks about technology to improve research, both as a means to improve cognitive testing, as well as even better using the incredible gift of brain donation and how artificial intelligence may unlock new secrets through big data. We'll learn about technology in the form of 3D video games and gadgets to monitor and improve sleep, both of which may aid in improving quality of life and even cognitive performance. And we'll learn about how technology in the home may help to keep loved ones with dementia safer. It's a cutting edge and an exciting agenda. Before we begin, a few housekeeping notes. You already know where the bathroom is, but I want you to know that after each lecture, we'll be doing a live Q&A. Our faculty are safely in their homes and offices and are looking forward to taking questions from our attendees. If you are live streaming from YouTube or Facebook, you can type your question in at any time. We'll be receiving typed in questions and we'll relay those to our faculty. Throughout the day, we will have brief commercial breaks, so please take that time to hear from our sponsors, grab a quick snack, and hurry back for the next Tech Talk and live Q&A. I want to thank our many sponsors for this important event. They include Belmont Village Senior Living Aliso Viejo, Biogen, Cal Optima, Care Assist Services, Caregiver Resource Center of Orange County, Caring Companions at Home, Companion Hospice, Diva World by Dementia, Granny's Place, House Call Doctors Medical Group, Independence at Home, Live Home, Optimal Hospice Care, and Sorrentis Clinical Research. You'll hear more from some of these sponsors through the day. I also want to give my heartfelt thanks to the people behind the scenes who made today possible, working to plan this important virtual event. They include Melissa Klabe, Veronica Magor, Ashley Houston, Aaron Gutierrez, and Mark Odom from Alzheimer's Orange County, Will Alvarez and Kyle Good from UCI Media, and Kirsten Klein and Chelsea Cox from UCI Mind. These people put in tremendous time, energy, and effort to make what we hope will be a fantastic product for you today. With that, it is time for our first presentation from one of the nation's true leaders in the technology of computerized cognitive testing and a dear friend and colleague. Dr. Doreen Rentz is a professor of neurology at Harvard Medical School with dual appointments in the departments of neurology at Brigham and Women's Hospital as well as Massachusetts General Hospital. Doreen is an experienced clinical neuropsychologist who's been a mainstay in the field for several decades. She holds numerous important titles, including being co-director of the Center for Alzheimer's Research and Treatment, director of neuropsychology, as well as the Outreach Recruitment and Engagement Core for the Massachusetts Alzheimer's Disease Research Center, and clinical core director for the Harvard Aging Brain Study. She's been leading efforts to design computerized and tablet-based cognitive outcome measures, especially for secondary prevention trials in Alzheimer's disease, and is a major proponent for validating these at-home computerized assessments. Please enjoy this presentation from Dr. Doreen Rentz.